joined us from Philadelphia. Representative, welcome. Next, we have Richard Edley. Up next, President and CEO for Rehabilitation and Community Providers Association of Pennsylvania. Richard, welcome.
Thank you. Good morning.
And you can begin whenever you're ready.
Okay, thank you. Again, my name is Richard Edley. I'm President and CEO of RCPA, the Rehabilitation and Community Providers Association. And we represent over 330 agencies and organizations throughout Pennsylvania, throughout the Commonwealth, in health and human services, serving well over 1 million individuals a year. And specifically, our members offer mental health, drug and alcohol, intellectual and developmental disabilities, medical rehabilitation, brain injury, long-term living, and other related services for children and adults in all settings. Now, I've submitted my testimony, so I won't be reading that, and what I'd like to do is hit some of the high points, especially since I think Lisa Allen probably stated a lot of the things that we all are, the sentiment and the statistics that we all share today. First, I do thank you for having this meeting here today. Obviously, as you said, it's a critical issue to all of us and those that we serve. And I'm actually in a somewhat unique position to be talking about this today because just last week I was in Washington meeting with several representatives as well as Senator Casey and Senator Toomey's office talking about all these issues and all these numbers. And I wish I had a good message for all of you today from those meetings, but what was clear to me from that was that the AHCA is real. It's a real threat, and it could and will likely happen. And what I was also told by several of the elected officials is don't count on a miracle, and it's time to begin the serious preparation. So again, I thank you all for having this meeting here today. What also came across in those meetings is how uniquely disadvantaged Pennsylvania is for AHCA compared to other states. We have sort of the worst of all worlds, or the best depending on how you look at it, but we have a large rural demographic, a large population of elderly individuals compared to other states, a significant drug and alcohol issue, and heroin and opioid epidemic. Even though that's a national problem, clearly in Pennsylvania we exceed a lot of the other states in statistics. We have a very high, although I will say appropriate, use of mental health and drug and alcohol services in the MA expansion. And we already have a robust managed care system in place which has managed costs over many years. All of those things, which I'll get into my testimony, add up to even a worse AHCA outcome than some of the other states. I also provided, I believe you have, it was passed out to you, as part of my meetings in Washington, I signed a letter to Senators Casey and Toomey with about 26 other statewide associations and handed that to them, detailing some of these issues and detailing the problems and the Pennsylvania statistics. I provided that to you today. Also, I gave them a sort of a one-page front and back data sheet specific to Pennsylvania Medicaid and the impact that this would have. That was given to me by a national organization, the National Council. I thought it had some very interesting and good numbers, and I gave that to all of you as well today, so that's in your packet. A couple of things on just general perceptions of the public and, unfortunately, the elected officials that I met with last week. There's still widespread misconception that Medicaid is about health care for the able-bodied and poor. I heard that term so many times last week. Well, we're not about funding able-bodied people, and that's how people are viewing Medicaid. No one wants to talk about the populations you were referring to, Representative DiGirolamo, people with disabilities, mental illness, substance abuse disorders, brain injury, the elderly, children, and the many, many vulnerable populations. And if you believe that Medicaid is serving able-bodied individuals, you could only imagine what the perception is of Medicaid expansion and who that serves, and that misperception. You heard the numbers from Lisa Allen. Over 700,000 Pennsylvanians have enrolled in Medicaid expansion, and I'll give you some statistics as well about how many of those accessed needed mental health and drug and alcohol services. Also, what's being discussed with AHCA is, again, the use of block grants or per capita caps, and we're on record as being opposed to both. The reason is simple. Limiting federal Medicaid funds to Pennsylvanians will place the population served by our members at serious risk. The problem is simply that these methodologies develop payments based on historical costs. There's no way to rebase these projections based on any catastrophic or trends. And the trending moving forward is being talked about as things like CPI, CPI medical plus one, all very interesting, but does not have anything to do with the actual experience of what's needed to serve these individuals. I'll also tell you that for many years prior to being with the association, I was the CEO of a behavioral health managed care organization in the state. And a number of people have said, well, you were a CEO and you handled Health Choices dollars. You were just given a lump sum and had to manage it. Isn't that a block grant? Isn't that a per capita? Didn't you have to manage Health Choices just like that? And I want to point out the difference. The funds that we were given in Health Choices were based on an actuarially sound and certified analysis, which included proper trending. We also were allowed to express areas of concern and come back to the actuaries and say, you need to consider the following as we move forward in serving this population. And the goal of the program was always to manage the costs and manage services properly, but bring it down versus the trend. It was never about cutting services and rationing care. And make no mistake, that is what AHCA is, whether by design or as an unintended consequence of repealing and replacing ACA. So to repeat the general message that we all know here today, that if these funds go away, we're all going to be in a collective position of figuring out how's the state going to possibly cover this, and we'll be in a very difficult position where vulnerable Pennsylvanians and those with disabilities will have to get in line and vie for this limited pot of money. A couple of other statistics. We can all argue about the budget here in Pennsylvania, but we know it's not good. And we all hear things like the $3 billion structural deficit and things like that. Well, again, if the proposed AHCA brings an additional $2 to $3 billion annual hit, what will that do? And also in the data that I gave Senators Casey and Toomey, there's a recent study that done by George Washington University Milken Institute of Public Health that stated that forget about everything we're talking about today in terms of serving individuals. If you just look at the economics of it, that they estimate that the repeal of the ACA in Pennsylvania will cost about 137,000 jobs right off the bat annually in Pennsylvania related to healthcare and so forth. Another point I'd like to make is that we're talking about people receiving things like mental health and drug and alcohol services. If you do not serve this population, it doesn't just go away. And I think we all know that. And we've heard things like it will be uncompensated care, emergency room care, cost shifts to the physical health system, increased homelessness, increased incarcerations. There will be a cost. We're just taking the cost off the top line. What I wanted to then now do is just hit a couple of the specific populations that our members serve at RCPA in different population groups. First, intellectual and developmental disabilities. Right now, the Office of Developmental Programs spends about $3.5 billion a year with the federal match, and there are still unmet needs. While 55,000 Pennsylvanians are receiving some level of support from Office of Developmental Programs, I know some of you in this room also know there's about 13,000 on a wait list, of which about 4,000 are on an emergency wait list. If today, with this current funding and federal match, we still have 13,000 people unable to access needed services, what would possibly happen if AHCA comes into play? There's also some significant design shifts that Deputy Secretary Nancy Thaler has proposed, all of which are wonderful and we can support in terms of helping people with increased community participation and increased staffing to get people out into the community. How could that possibly be funded under these proposed changes? In terms of children's services, I think you heard before that 2.8 million are being served through Medicaid in Pennsylvania. 1.2 million of them are children. A reduction in this federal share will limit parent enrollment and would obviously have a negative impact on children with great needs, medically fragile, mental health needs, children with early intervention and special education needs. And then as we go to adult mental health, I mentioned before that with Medicaid expansion, more people have accessed care. We estimate about 160,000 new people were enrolled with Medicaid expansion with a mental health diagnosis. This means more recovery-oriented treatment, community care, and services that allow people to recover and live productively in the community. Without these funds, you will no doubt see less family-based support, less outpatient care, less inpatient care, a significant decrease in the ability to cover emergency and crisis intervention, and so forth. We know that with access to the right care at the right time, these individuals can and do recover from mental illness. We have to preserve access to and adequate funding for Medicaid for these individuals. And then substance abuse disorders. RCPA represents approximately 70 drug and alcohol agencies with about 170 facilities and locations throughout Pennsylvania. Medicaid expansion has literally been a lifesaver for many of the individuals these agencies serve. We've estimated about 97,000 Pennsylvanians have come into Medicaid expansion with a substance abuse disorder. Medicaid expansion has allowed these individuals to receive treatment for substance abuse disorders that they simply were not eligible for prior to Medicaid expansion. And then a final population I wanted to talk about, brain injury, individuals with brain injury, aging, and physical disabilities. It's estimated that next year 70,000 individuals with physical disabilities and elderly are projected to need Medicaid-funded services to help them live in the community rather than in costly institutional settings. That's just next year alone. So 70,000 people we would be funding to keep in the community rather than an institution. We also are expecting to get over $1.3 billion in federal funds to support these critical services in such programs as the proposed Community Health Choices, which is going to be implemented in January. If Pennsylvania receives less Medicaid funding from the federal government, wait lists for community services and aging and physical disability will clearly rise. People who need community appropriate settings will thereby be hampered in terms of being kept out of institutions and productive in the community. Many people with disabilities and seniors who rely on these services do not have family or supports that they can simply fall back on for their daily needs to protect them and their health and safety. So when we take this in whole, I think we're all saying the same thing, but I think I go back to my original statement, which was somewhat shocking, that in Washington, well, let me put it this way, we're sitting around the table listening to these numbers and getting it. I was surprised at how many people in Washington would listen to me and then simply fall back and say, but aren't we talking about the able-bodied? I'm thinking we're right back where we started. And so, again, the message that was given to me by many of the representatives and the senator, Senator Casey, was don't expect some magical solution. This is happening. We have to figure out in Pennsylvania, what are we going to do with this vulnerable population? How will we make sure services are preserved? How do we make sure people have access to services? And so I appreciate the committee looking at this very carefully and making some decisions, making some analysis of what this will actually mean. And certainly RCPA, and I know all the other people in the room today, stand ready to help you, the legislature, and the General Assembly, and the governor to do what's in the best interest for Pennsylvanians.
Okay. Richard, thank you, and I hope you can stick around. And I want to personally thank you and your members, your providers, for the absolutely amazing work that you do around the Commonwealth and providing services for our most vulnerable citizens. Thank you.
Thank you. Appreciate it.